Hello and welcome to the second of our free CPD webinars this week, looking at what you need to know if you're teaching schizophrenia for AQA this year. So this is one of three webinars available this week. We had one yesterday evening looking at Year 2 planning and smart option choices, which is now trending heavily on YouTube. We've got tonight's one on schizophrenia, and then we have another on Thursday evening looking at are you ready for Year 2 biopsychology and the differences between Year 1 and Year 2 content and what your students need to know for that. Tonight's webinar is divided into sort of four sections. We're going to look at sort of understanding the specification and know exactly what is in there in terms of exam questions. We're going to look at how to spark student interest in schizophrenia with a series of 3 activities that will hopefully get your year off to a really good start. Thirdly, we're going to look at the problems of genetic explanations and how to use AO1 content and AO3 content effectively, and a nice activity that will just help you embed that. And then last but not least, and really important, we're going to look at effective evaluation and historically the problems there's been with evaluation when it comes to schizophrenia, and again an activity designed to help you with your student evaluation. So let's make a start. Let's looking at the specification to begin with as a really good starting point. On the screen you'll see the sort of mapping of the specification, and I've put in bold all of the sort of key elements of the spec that are really specifically named this year. So most teachers will start off by teaching classification, and there are 4 key things that you need to understand in terms of hallucinations and delusions, speech poverty and avolition. You also need to then look at the reliability and validity in terms of diagnosis and classification. And again, 3 key terms looking at comorbidity, culture, gender bias and symptom overlap. As with the legacy spec, you need to know biological explanations, and there are 3 of them: genetics, the dopamine hypothesis, neural correlates. You then need to look at psychological explanations, including family dysfunction, cognitive explanations and dysfunctional thought processing. Then you look at the treatments, so you look at 2 drug treatments, typical and atypical antipsychotic drug treatments. Then look at psychological therapies, which includes 3 of them, so CBT, cognitive behavioural therapy, family therapy and token economies. And then last but not least, you'll round it all off with the interactionist approach and how we can bring biological theories and explanations together with psychological ones. Now, what's probably more useful is knowing how the exam is mapped around the specification. So what I've done for you is I've looked at the 3 new sample papers, and I've pulled out all of the questions and mapped them to the specification, so you can see the types of questions students are likely to be asked for each of the different points in the spec. On top of that, what I've done is I've reviewed all of the potential essay questions that could come up, and I think this will help you focus your teaching on some areas more than others. So within the classification area, there are 2 potential essays that could come up. You could get describe and evaluate classification and diagnosis of schizophrenia, or you could get discuss reliability and or validity in relation to diagnosis and classification of schizophrenia. So you've got those 2. In terms of explanations, you could get discuss biological explanations for schizophrenia, and you could get outline and evaluate 1 or more psychological explanations for schizophrenia. I've put another question in italics that's not appeared anywhere but is a potential one that I think could come up, and it's outline and compare 2 explanations for schizophrenia. I've seen this command term compare appearing more this year, and I think it's certainly possible for them to ask you to do that, compare or contrast them. In terms of treatments, this is where I think your teaching will have a bit more time spent on it, because you could be asked to outline and evaluate drug therapies, of which you'll need more than 1, it's plural. In terms of psychological treatments though, what's particularly interesting is if you look through the sample papers, the textbooks and exam pro, what you'll see is that they not only ask a generic question on psychological treatments, such as number 2, so outline and evaluate psychological treatments, but you can also seem to be asked sort of a very specific question here, picking out the points in the spec. So outline and evaluate cognitive behavioural therapy, or something like discuss token economies as a method used in the management of schizophrenia. So I think you'll definitely need to focus on preparing your students for a specific essay within psychological treatments. Finally, the question that sort of has shown us this command term, which is on Exam Pro, outline and compare 2 treatments for schizophrenia, a very different sort of type of question to what we're historically used to. So we might want to start embedding more sort of comparison skills into our teaching this year. Last but not least, in terms of the interactionist approach, there's 2 potential questions that could come up there. It could be describe and evaluate the interactionist approach to explaining and treating schizophrenia, or it could even be slightly more specific, outline and evaluate the diathesis stress model of schizophrenia, which essentially is a very similar type of question. So there we have it. That's the specification as an overview. You've got access to all of those potential questions on the PowerPoint slides made available at the end of this session. Okay, what I want to look at now is 3 activities that will hopefully really spark student interest in this topic and get you off to a sort of flying start this year. So I'm going to take you through a series of 3 activities that I hope you use really at the start of your teaching this year. The first activity is called Schizophrenia Before and After. And the aim of this activity is really to provide you with your first starting point for teaching schizophrenia by assessing what your students do and don't know about this disorder. In reality, actually, there's a sort of overriding goal to this particular activity, and really it's actually to dispel some of the myths and misconceptions around schizophrenia before you get into the sort of heavy teaching of the topic. I think it's quite nice to actually thrash out what the students think schizophrenia is before, and then tell them in most cases they're pretty much incorrect. Now, the way I would do this, the way I would potentially launch this activity, is provide your students with a Venn diagram, and there's one provided in the resources. And I would probably start by watching a sort of really sort of media typical clip of schizophrenia. So I would choose something like Me, Myself and Irene, the film trailer that's on YouTube. It's about 2-3 minutes long. And get the students to, in the sort of left-hand side of their Venn diagram, write down what they think they know about schizophrenia or what they do know about schizophrenia before you've actually taught them anything. So it might be that they think it's split personality disorder. They may well know that it's more common in men. They might think there's no cure to it, something like that. You want them just to jot down everything they know about this before. Before you go through it, there's a second part to this activity just to really sort of thrash this out a bit more with your students. So before you tell them whether they're right or wrong, there is then a series of 10 true or false questions which the students can read to decide if they think it's true or if they think it's false. So just to give you a couple of them. The first one is schizophrenia is where a person has split or multiple personalities. So they might say, yeah, they think that's true. There's one on there that says people who suffer from schizophrenia are 10 times more likely to commit suicide. So again, they'll decide whether they think it's true or false. Do encourage them to write an answer because there is an extra column for them to then correct themselves and write down the real answers in a moment. Where you would then go at this stage is to actually try and dispel the myths. So you would provide your students with the correct answers, plus the interesting facts that I think go along there. And I've given you some of the interesting facts so that you can simply read them out as you go through. So you might say for the first one that actually it's nothing to do with multiple personalities. And while there are sort of elements of split personality in there, that multiple personality disorder is actually a completely separate disorder and they are 2 different conditions. And that then ties into symptom overlap, which we'll talk about later. So just go through the answers and tell them where they're wrong. What you can then do at the end of the lesson or at the end of the topic, whatever sort of time frame you want to use this over, is go back to the Venn diagram and then get them to plot on there what they now know about this particular disorder. So they might now say it's usually diagnosed between 16 and sort of 25, 26. They might say that treatments include things like drugs and CBT. And what you're hoping to do through this activity is really dispel the myths and misconceptions and get them to have a much more accurate knowledge and understanding of what this disorder is. Okay, second activity, again, probably used right at the start of the course or very close to the start of the course, is an activity called Matching the Clinical Terms. Really, really simple idea. Now, the aim of this activity is to help students to develop their knowledge and understanding of the symptoms of schizophrenia, while making the clear distinction between what is a positive symptom and what is a negative symptom. Now, different ways you can use this activity depending on your preference and time available. You could ask the students to just do a simple match-up task where they draw an arrow from the sort of keywords on the left to the definitions on the right. You could ask them to cut them out and use it as a sorting task. It's entirely up to you. The first part, whichever option you choose, they need to clearly match the key terms and the definitions. What you want them to do after that is to either highlight the definitions or sort them into 2 categories. You want them to sort them into those that are positive versus those that are negative. The answers are provided, and again, it provides you with a really nice, interesting opportunity to explore positive and negative symptoms of schizophrenia, because there is some sort of debate around some of them, like catatonic behaviour, as to why that's a positive symptom and not a negative symptom, and it just provides a really nice discussion point. Do be aware that I've provided more symptoms than you actually need. So you may think actually you don't want to teach your students additional ones because they're not named in the spec. So in which case you might want to cross out or remove before you start this activity all of them. But the 4 that you need, of course, are delusions, hallucinations, alogia and avolition. So you need those 4. The third activity that I mentioned in yesterday's webinar is called Schizophrenia, Depression or Bipolar. And this is a really nice activity. It could take quite a long time, maybe over a course of a whole lesson, and there's a lot you can draw from this activity. The aim of this activity is to look at what's called symptom overlap between schizophrenia and other disorders, in particular things like depression and bipolar. Now, the way the activity works is you'll provide your students with a sort of word bank of different symptoms for the three disorders. And your student's job is to decide where those different symptoms occur. Do they belong to schizophrenia? Do they belong to depression? Do they belong to bipolar? Or do they belong to more than one or all three of those disorders? So that's what you want to start by doing. It's a really great point at this stage in the course to actually use this as an opportunity to revise some year one content. And if they've listed out all of the different symptoms for depression, what you can then get them to do is say, well, actually, which ones of those symptoms are cognitive, which ones are behavioural, and which ones are emotional, to revise some of that year one content. The activity kind of finishes where the students use their Venn diagram to answer 4 key questions that specifically target concepts like validity, comorbidity, and evaluation to get them really drawing all of this together and provide a really nice opportunity for an in-class discussion. So those are sort of 3 activities that I think you might use right at the start of the year, but hopefully will really get your students motivated and interested in schizophrenia, especially if you've decided to tackle this topic as one of your first topics of the year. Okay, on to the next section. We're looking at the problem with genetic explanations, and there's 2 aspects to this. The first is sort of how to use AO1 and AO3 content effectively, and we'll talk more about that in a moment. And I'll provide you with another activity called Schizophrenia Sort that we'll also discuss. Let's imagine you had the following exam question. So discuss biological explanations for schizophrenia as a 16-mark question. Now, the mark scheme for genetics is really, really vague, and that makes it quite interesting. So let's imagine your students have chosen 2 biological explanations. They've chosen, I don't know, genetics and neural correlates. The problem with genetics is that there isn't actually that much to say other than, according to the genetic explanation, schizophrenia runs in families. You can't really develop it much more in terms of core knowledge. And that's all the mark scheme says. And here's an examiner comment that highlights this problem even further. So the examiner said genetic explanations were often straightforward descriptions of genetic studies where AO1 credit could be awarded. There were whole schools and colleges where no students achieved the highest mark bands because the description lacked the necessary detail. And that's a real shame, and I think it highlights an issue with the sort of way the specification's laid out or even marked in this case. Let me show you an example, and I'll explain why this occurs and the reason this occurs. I've taken this from one of the sample essays that we've written, and you've got access to this in the resources at the end of the session. So let's imagine students wrote the following. They've said, there is considerable evidence which indicates that schizophrenia runs in families and is in part genetic. Okay, so they've set the scene. They then go into evidence, which is interesting. So they're using here evidence actually as their knowledge. So it says evidence from family and twin studies provides support for the genetic explanation for schizophrenia. Okay. It then says researchers found much higher concordance rates in MZ twins in comparison to DZ twins. Great. Go on to give the examples. They say, for example, Goatsman and Shields found a concordance rate of 42% for MZ twins and 9% for DZs. In addition, a study in London used the Maudley twin register and found a 40% concordance rate in MZ twins compared to 5.3 in DZ twins. Now, what you might find is that many students will stop here thinking, okay, I've given you the knowledge and I've shown you some sort of twin studies. That's my O1. But it's actually not. They have to go on to explain, well, why is that part of the genetic explanation? What does that show us in relation to genetics? And that's where what I've highlighted on the screen now becomes really, really important. So the research shows that individuals with identical genetic makeup, that's MZ twins, have an increased risk of developing schizophrenia, which highlights the genetic component supporting the genetic explanation. So while that may look on the surface as if it's an AO3 comment, it's actually really just concluding the AO1 section, and they would be awarded essentially, even though it's marked holistically now, this could be taken into consideration as AO1 content. So it's important they justify why they're using these studies. Now, I've given you the whole sample essay in the pack as a Word document so you can edit it and play around with it. And there are loads of activities that you can use to be really sort of beneficial with sample essays and not just simply giving them the essay. That wouldn't be very useful. Just to give you a couple, for an essay like this, I would ask them to highlight where the AO1 knowledge is and where the AO3 evaluation is. A great thing you can do thereafter is ask them to deconstruct the essay. So you could ask them to turn it into a bullet point plan, so they walk away with a series of, say, 6 or 7 bullet points, so they know that this is an overarching structure. You could ask them to use the peer assessment grids we've developed and mark the essay and suggest possible improvements, always a really useful one to do in class. Last but not least, an activity I didn't use that much, but I've seen being used, and I think it's a fantastic activity. What you can do is cut the examiner commentary off the side and separate them all up, and ask them to, in groups, decide where the examiner comment goes in that particular essay. So can they match up where the comments actually go in a particular essay? As I mentioned, I've given you the Word version of this, and where the title says social, that should obviously say schizophrenia. I've given you the Word version because there's many other things you can do. You could take out keywords and ask them to fill in the specialist terminology. You could cut out whole sentences and ask them to elaborate. So there's loads of ways you can use this particular task in class. The next activity, building on from that, is an activity called Schizophrenia Sort. And this will probably come at the end of your teaching of both biological and psychological explanations. And it's a really nice activity to provide a structure for an essay that can then be used to set an essay either as a homework or an in-class assessment. The way it works is I've given you loads of blue and pink cards, and the idea is that the students sort the blue cards into what is either a biological or a psychological explanation. After that, they then match their pink cards, which are evaluation points, and there's a lot of them, to the different explanations. Okay, so if they've mentioned genetics, they might bring in the Gottsman twin study as the evaluation pink card that supports that. They can then start to move the cards around and actually construct essays for different questions. So you might then select an essay question and say, right, next lesson I'm setting you this question, discuss one or more biological explanations. Create a structure now as a group, take a picture of it, and then prepare it for your next lesson. So there's loads of ways you can use it as a really nice task, but you want them to walk away with at least two different structures, one for a biological essay and one for a psychological essay that they could then use in the future. Okay, moving on to the final part of this particular webinar, which is looking at effective evaluation, and something that we mentioned yesterday that we're going to come back to time and time again. I want to start with looking at what the examiner said, look at a final activity, developing biological evaluation, and then again look at how do we embed issues and debates effectively. I'm just going to show you two examiner comments that I think are really important and will help you a lot. The first one is an evaluation comment. It says, in better answers, evaluation is clearly organised around three main areas: appropriateness, effectiveness, and ethical issues. So this is referring specifically to those treatment essays that you could get, the psychological treatments or the biological treatments. The second comment is about issues and debates, and it's got a great phrase in here that I really like. It says, in particular, drop in references to issues and debates, such as it's reductionist or it's deterministic, show a weak understanding and gain little or no credit, and we're going to focus on that specific point in a moment. So let's start with evaluation. What I've done is I've looked through the sort of last 6 or 7 years of sample questions, mark schemes, examiner commentary. And I've picked out what exactly do the examiners mean when they say you can use appropriateness. And I've framed it around key questions that you can give to your students when evaluating different treatments. So the first one is, are some therapies more appropriate than others? So would it be more appropriate to use drugs or CBT? For example, if someone is particularly suicidal, there is an argument that drugs are more appropriate because it's a faster treatment and therefore may prevent them from committing suicide, as an example. You could then look at what different factors affect the choice of treatment. So are there financial constraints? Is CBT actually just too expensive? Is there the availability of an appropriate therapist? CBT on the NHS typically takes anywhere between 6 and 8 weeks before you will even have an appointment. Is that too long? And it also depends on the accuracy of the original diagnosis. So if we've misdiagnosed someone, the treatment's going to become less appropriate for them. In terms of ethical issues, you can frame it around a series of questions. So are there any harmful side effects? Students love this point. So if there are side effects, what are the problems of those? Are there issues around informed consent with using particular types of treatments? Is the treatment dehumanising in a particular way? So many people argue that token economy, which is one of the psychological treatments or managing behaviours you look at in this unit, is dehumanising because it's really a childish type of treatment, and it's using principles of sort of classical and operant conditioning to condition humans, and that's wrong. Last but not least, in terms of effectiveness, you can actually come back to your side effect point and say, well, actually, if there are side effects, could that reduce the effectiveness of the treatment? So, for example, if someone's having horrendous side effects with their antipsychotic drugs, that might then make them stop taking the drugs and therefore they relapse, making the treatment ineffective. How can we measure the effectiveness of different treatments? So can we use drug experiments, placebo trials? Is it possible to measure the effectiveness? Two really key questions. I'll put them both up together then. Is the treatment curing the symptoms, all of them, or just some of them? Because if it's only doing some of them, it would then suggest that actually it's not particularly effective. Or is the treatment actually curing the disorder or just masking the symptoms, which is one that students often get to grasp really, really well, that actually are the drugs just simply masking the symptoms someone has and not really actually stopping the actual underlying issue or problem. And lastly, I've mentioned this already, do placebos have an effect? Because if they do, there's an argument that can we just treat people using placebos then? So that's the first one. Different questions you can use to enhance your students' evaluation around those three key sort of areas: appropriateness, effectiveness, and ethical issues. The last thing sort of on this webinar is this issue called the drop-in effect, which relates to issues and debates being thrown into evaluation paragraphs, and it's easier for me to illustrate that. So let's imagine we had a question outline and evaluate biological explanations of schizophrenia. Starting point to the evaluation, someone might say one, strength of the dopamine hypothesis comes from research support. Fairly good starting point. They bring in some evidence. They say Owen found a larger number of dopamine receptors in schizophrenic patients examined through autopsies. Okay, fairly good evidence in there. They then explain it and they say, well, this suggests that dopamine is implicated in schizophrenia, as more receptors may lead to more neural firing and an overproduction of messages which could result in some of the positive symptoms associated with schizophrenia, for example, hallucinations. Really nice contained evaluation point. What students historically have done is then thrown on this point at the end, and they believe they're enhancing their work and they're not. They might just say, however, biological explanations are reductionist and they don't take into account other factors. And that's quite frankly a very awful evaluation point. It's added no value to that point. If anything, it's actually probably weakened their evaluation because it just looks sloppy. So what you've got to get your students doing from an early stage is not just throwing on a point, a drop-in effect. And let me go back to it. The reason it's called a drop-in is because you could pick that point up and place it in any essay that is to do with biological explanations. It's not been applied to that particular evaluation point. It's just a generic point, and that makes it a drop-in paragraph. So the key is embedding them, making it actually part of the evaluation. So what you want them to do is actually to embed it before they explain and summarise their evaluation point. So let's imagine we've got the point and the evidence and they're the same. So strength of the dopamine hypothesis comes from research support. Owen et al. Found a larger number of dopamine receptors in schizophrenic patients examined through autopsies. We then bring in the issue and debate. We're not explaining it, we need to embed it into the point properly. So we might say, however, the dopamine hypothesis says that schizophrenia can be explained in terms of dopamine alone and fails to take into account other factors, which is an example of biological reductionism. I've used the term biological reductionism here. I think it's really important to get your students using the specific type of reductionism. Research also suggests, and this is probably a bit more enhanced, but just to highlight how it can be done, research also suggests that dopamine abnormalities are not present in all patients, and therefore reducing the explanation to dopamine alone doesn't fully explain schizophrenia in all cases. Even without that final sentence, it would have still been very good. And then they need to explain bringing into account whole of that, and I've left the ending for your students and you to play around with. So therefore, while research supports the role of dopamine in schizophrenia, other factors may also play a role, and therefore, and this is the point, you then need to conclude it all. So I'll leave that open for you to think about. Activity 5 I put together this evening, so it's not been designed yet, but I've given you the Word version of it just so you can use it straight away. And the aim of this activity is to really build on and develop what I was just talking about, developing those AO3 skills and writing effective evaluation paragraphs for all of the biological explanations. It's a series of 4 different evaluation paragraphs with different points missing. And the idea is you want to get your students to complete those points. A couple of little hints and tips before you even try this activity. I think it's really key that your students can do the basics before you start to embed issues and debates. So if you know you've got a weaker cohort or some students that may struggle, make sure they can write the point, evidence, explain before you even start attempting to embed issues and debates. Only once they've mastered that first skill can you then get into sort of, can we start to embed those issues and debates in effectively. So nice activity for you to try. Okay, that brings us to the end of this webinar. As always, all of the resources are available immediately in our Facebook groups, so just search for AQA A-Level Psychology Teachers. Or if you're not on Facebook, they'll be sent out on our daily digest mailing list at 8 o'clock tomorrow. So all of the resources that we've just gone through, including the PowerPoint slides, are available. As always, please feel free to sign up to as many of the future webinars as you can. There are 23 remaining webinars this month and next month on many topics: research methods, biopsychology. Please do spread the good work that we're doing and try and get more people to come along to them so people can benefit from this. Encourage your students to join our group. And of course, if you've ever got any questions or need any sort of guidance, support, advice, always feel free to drop me an email. And my email address is on the slide there, joseph@tutortoyou.net. Thank you very much. Have a good evening.